This is Dr. Jerry Williams from Urgent Care 24/7. I want to talk to you real quick about dehydration. Now, I'm not going to get into all the reasons why a person could be dehydrated, because there's lots of them. And it could be your environment. It can be you just ran a road race or a marathon today. It could be viral or bacterial gastroenteritis from food poisoning, or some kind of dietary overindulgence or alcohol overindulgence. So there's lots of reasons. So we're not going to go diving into those. And there's also problems with GI illnesses that can cause someone to become dehydrated. So I want to get into any of those reasons. I just want to talk about if you have a dehydrated yourself or your family member or a loved one or a friend who's dehydrated, what's the best way to handle this? So first of all, the first issue is if it's an infant or toddler, you need to get oral rehydration as quickly as possible, but keep a very, very short leash on that situation. And if it's an infant or toddler, get them in to see a medical provider immediately. Children can't tell you, they can't communicate, and so and their cardiovascular systems can really compensate a long way until they can't. And so it can be a very abrupt change. So if you have an infant or toddler that's dehydrated, or a child, I encourage you to seek medical care immediately. Now, if you've got an adult and they can talk to you and they can cooperate, that's a little bit different ballgame. So I want to talk to you about those patients as well. And so a dehydrated adult or adolescent, that's different. And what the first thing we want to determine is, can they keep oral hydration down? Because if they have nausea or vomiting, obviously that's a problem, and you're going to need to seek medical care for antiemetics or anti-nausea and vomiting medications to try to combat that. The other issue that can be a problem is if they do have severe diarrhea. And a lot of people don't realize, they say, well, I'm not throwing up, but if I'm just having diarrhea. But if you're having diarrhea, you can actually become very dehydrated very quickly, because the colon's job is to absorb a lot of the electrolytes back into the body before the stool passes out of the body. And with diarrhea, that's obviously not happening. So you can get very dehydrated very quickly with just diarrhea. A lot of people don't realize that. They think, well, I'm not throwing up, I'm okay. So the best way to tell, as a rule of thumb, if you're dehydrated or not, is, are you making urine? Do you have a desire to urinate? Because if you're making urine, it means you're keeping enough fluids in your system to where your kidneys can actually make urine. Because the first thing that happens if you get dehydrated is your kidneys stop producing urine. So, or make urine much, much more concentrated, because the kidneys are working very hard to save as much fluid as possible and keep that fluid in your vascular system. So if you're dehydrated, first point, if the patient's not vomiting, by all means, have them take PO fluids. But what PO fluids? Well, if you've got stomach disorder or gastroenteritis or nausea or vomiting, you want to avoid dairy products, because those can be very hard to digest with the sugars that exist in dairy products normally. And you also want to avoid alcohol containing or caffeine containing beverages or drinks, because those cause your kidneys to diurese or to make urine, and that's not what we want. So you want to avoid caffeine. So any kind of energy drink or soft drink that has caffeine in it, you want to stay away from that. So sports drinks that are not caffeinated, not energy drinks, that have electrolytes in them, those can be very useful. Also, Pedialyte and electrolyte replacing drinks that are made specifically for that are also for dehydration, are very, very effective. So, and if you've got gastroenteritis that's causing or contributing to the dehydration, you obviously want to avoid solid foods and just do clear liquids until you can tolerate clear liquids for 12 to 24 hours, and then you can start introducing a very bland diet. So if the patient's an adult or an adolescent and can communicate with you, they're making urine, and they can keep fluids by mouth down, by all means, hydrate. Small, frequent sips. Don't drink large volumes at one time because that can dilate the stomach and cause vomiting. So, but small, frequent sips, just constantly sipping on electrolyte-containing drink, or which would include the electrolyte-containing sports drinks and or hydration replacement drinks such as Pedialyte or similar products are the best way to go. So, but if for any reason the patient does not continue to produce urine, or has continued severe diarrhea or nausea or vomiting where they're unable to keep fluids down by mouth, it's really important you seek medical care quickly so you can get on an anti-nausea medication, anti-vomiting medication to cut down or to eliminate the vomiting. And the patient may require IV fluids, and not a big deal. Important, you get the patient IV fluids by vein, and typically you can get the dehydration under control immediately. So I'd encourage you not to put it off. Don't wait until the patient or yourself are too sick, where you're very, very severely dehydrated. It can make it more difficult to start the IV. So I encourage you to seek medical care quickly if, again, if it's an infant or toddler, or if there's any kind of overlying illness such as a fever, severe abdominal pain, anything like that. And again, didn't want to get into the causes for gastroenteritis and the different reasons that one can be dehydrated, but if you're experiencing dehydration in yourself or a loved one, hope these tips are useful. I'm Dr. Jerry Williams with Urgent Care 24/7. Life is 24/7, and so are we.